So today we've been called to a 21-year-old female named Mel. So Mel's called us because of back pain. She stated that previously she's injured her back about 3 years ago, and she's going to physio for it, but within the last 3 months has stopped, and now she's re-injured her back doing yoga. So we've done a basic assessment of Mel, and we've just checked all her vitals, which are all within normal ranges. So her heart rate was 69, her rest rate was 14, her blood pressure was 129/87, and her temperature was 36.8. So now we're going to do a full assessment of Mel's back pain. So Mel, if I can get you to, if you're comfortable with it, roll towards the couch, and I'm just going to have a palpate of your back, if that's okay with you. Oh. Okay, so I'm just going to have a feel down your spine. Let me know if it hurts, okay? So I'm going to start at the neck here.
No.
No pain?
No.
No funny feelings?
No.
So nothing down the middle here?
No.
And what if I go to the side up here?
Yeah, just there.
Yeah?
Just right there, yeah.
And nothing on the other side?
No.
No. Okay, and now we're just going to have a feel of your tummy. No pain here?
No.
No?
No.
Cool. Okay, so have you been generally well?
Yeah. Yeah.
You got no other medical history that I should be aware of?
No.
No
just
allergies?
injury. No allergies.
Okay. Have you been toileting normally?
Yeah.
Okay, so we just want to make sure that we rule out any renal issues that could possibly be there. So now, do you have any pain anywhere else apart from that right side?
No, yeah, no, it's just that right side, yeah.
Okay, no pain down your legs?
No.
No? Okay, so I'm just going to check. I just want you to push on my hand.
Yeah.
Okay, now pull back. Does that hurt at all?
No.
Any funny feelings?
No.
And do it to the other leg. And pull back. Okay, good. We're also just going to move your legs just to make sure. Please shout out if there's any pain at all.
It's like a little bit sore, but it's just the back,
Just
not
the
the
back?
leg.
Just try the other leg.
That one's fine.
Everything's fine. No funny feelings anywhere else?
No.
Okay, cool. So we've ruled out that there's no other pain anywhere. Have you had any other traumatic injuries occurring?
No.
No.
Just my yoga.
Just the yoga?
We've just
finished assessing Mel, and now we're obviously going to be looking at treatments for her pain. Mel, on a scale of 1 to 10, 10 being the worst pain imaginable and 1 being nothing, what's her pain like at the moment?
Probably a 4.
A 4?
Yeah.
And what type of pain is it? Is it kind of like stabbing? Is it an ache?
It's
or-
like a constant ache, just in that area.
Yeah.
The lower back.
And have you taken any medications for it?
No, I just put a heat pack on it.
Okay, cool. Do you have any allergies to anything?
No allergies.
And also, do you think you could be pregnant?
No.
No? Okay. So we're going to look at giving you some paracetamol, ibuprofen and tramadol. Have you had tramadol before?
I have, yeah.
Yeah. And how was that for you?
It was okay, yeah.
Okay, cool. So my offsiders drug checked all my medications for me. So what we're going to get you to do is, do you think you'd be able to sit up for us?
Yeah.
Just take your time. And how does that feel?
It's like an aching, but it's okay.
Okay, cool. So we'll give you 3 paracetamol, so that's 1.5 grams. And we'll give you 3 ibuprofen, so that's 600 milligrams. And 1 tramadol, so that's 50 milligrams. We'll have a glass of water for you here. Take that. So just through the advice, because I think leaving you at home would be best. In the comfort of your own home, you don't really want to have to go away to the hospital.
No, not really.
So what we've got here is a lumbar back pain information sheet for you, just giving you all details. Also, I recommend that you go to your GP within the next 12 hours to get looked at, and hopefully he can refer you back to your physio.
Yeah.
Did the physio help your back pain when you're...
Yeah, it was really good. Yeah.
So hopefully he can get you back onto that. And also, if the pain medication starts wearing off again,
Yeah.
so with it like after 4 hours, you
Yeah.
can take some more paracetamol and ibuprofen. Just follow the instructions on the box for how much you take.
Okay, thank you.
So now that we are thinking about leaving Mel at home, we need to go through the non-traumatic lumbar back pain red flags. So I've already asked her some of these questions that cover it. So she's got normal toileting, so no loss of bladder or bowel control. Her temperature was normal and under 38 degrees. All her vital signs were normal. She had no pain anywhere else, no altered sensations. She mobilised normally. She just got up to go warm up her heat pack for her back. She's generally been feeling well, and she has normal power in both of her legs. So now that we've done that, we need to look at the R35 checklist to make sure we can leave her at home. So this covers the patient has been fully assessed by me. None of the vital signs are abnormal. She has no serious illness or injury. No red flags are present, which we've just checked. The patient can mobilise. So I've advised Mel about going to the GP, and I'm going to fill out the patient report form and give her an ACS form so she has access to all of the information that we've investigated today. And we've advised her on all the things necessary, so we've done this checklist, and so she's okay to be left at home now.
We've been called to a 20-year-old female who has called us today because she has a nosebleed. Terri tells me that she normally suffers from nosebleeds, but today it's just kept bleeding, and so she's called us. I've asked her to compress her nose to holding it on the fleshy part just above the nostrils here and lean forward with a tissue, and we're going to sit like that for roughly 15 minutes just to see if the bleeding stops, and if it doesn't, then we can reassess and go into using iron adrenaline. Terri's normally very fit and healthy. She doesn't have any medical history, she doesn't take any medication, she's not on any anticoagulants, and she's been well recently. She hasn't had any trauma to the nose, she's in no pain. And she states that normally this happens because of the heat. I've done a set of vitals, and all her vitals are within normal limits. So what we're going to do now is we'll just sit and wait for 15 minutes, and then we'll reassess and go from there. So we've reassessed Terri's nose, and the bleeding has stopped from one nostril but not the other, so I've decided to go ahead and give intranasal adrenaline. Terri doesn't have any allergies, and we approximately have guessed that she's lost about 250 mils of blood. So what we'll do now is draw up the medicine. So I'm wanting to draw up 1 meg of adrenaline to 9 mils of saline. My drugs have been drug checked by my offsider already, so we'll go ahead and do this now. So here I've got my sodium chloride, which is 0.9%, and I'll be drawing that up in my 10 ml syringe. This is obviously a sterile field, because we want it to be sterile. I've got that in the bin. So I've got my 9 of saline, and then I've got my adrenaline here. It's also been drug checked. So we're drawing up just the whole mil, which will give us a dilution of 1 in 10,000 with the sodium chloride. Alright, and so now what I'm wanting to do with my 10 is I'm going to be giving 2 mils through just into one nostril. So I'm going to use a 5 ml syringe and draw up the 2 mils into that syringe just so I'm more steady with my dose. There's no kind of chance of me giving too much. I know exactly what I'm giving. So we'll do that now. Shuts out. So this has been labelled because it still has adrenaline in it, and we'll pop it over here. So we've got here the 2 mils of adrenaline. I'll take off the blunt needle and put in the sharp spin and attach the intranasal device. So it's ready to go. This will also be labelled with an adrenaline sticker, as well as the other 8 mils that I haven't used.
Oh God.
Jeepers. Okay. Alright, so because the bleeding hasn't stopped, I'm wanting to give you this adrenaline in the nostril, okay? So this kind of just sits right in the tip there, and it's like a mist that comes out, and it's just kind of salty water. And I'm wanting you to take a nice big sniff in when I give it, okay? If the bleeding stops, then we can leave you at home, and I recommend that you see your GP within the next 12 hours. But if it doesn't, then I will have to pop you through to the emergency department, alright? How does that sound? Are you happy with that?
Yeah, sounds
Okay.
good.
So before I give this, I want you to do a nice blow. It dislodge any clots that are sitting in your nostrils. Very good. Okay, so now what I'm going to do is I'm just going to sit this in your nose. And when I say go, I want you to take a nice deep breath in, okay? I want you to go for me, okay? 3, 2, 1. Very good. And now I want you to compress the nose again, just like you were doing before, and just lean forward for me. So what we'll do now is we'll leave it for 15 minutes like I've said previously. We'll reassess and go from there, so we can either leave you at home or we'll pop you down to the emergency department.
Okay.
I like yours, like maybe I just push it slowly. Right, so as you can see, Terry's nosebleed has stopped successfully after giving the intranasal adrenaline. There's no need for you to go to the emergency department today. I do recommend that you see your GP within the next 12 hours. So what I need to do from here is I need to do some paperwork, fill that out and give you a piece of paper, your ACS form that you can take to your doctor, and they can type in the code and see everything that we've done today, our full assessment, all your vital signs and that kind of thing. We need to run through the R35 checklist, which doesn't really mean much to you, but basically it's all these things that are boxes I need to tick to say that it's safe to leave you at home. You're not in any pain at the moment?
No.
Okay, so we've done a full set of vitals. You've been fully assessed. There's no serious injury or illness that needs to be ruled out because we've done it, we've fixed it. We don't have any red flags that apply for epistaxis. I have seen you mobilised previously. She's walked and picked up some more tissues and then come back. And you've been given a full explanation as to what to do next. So I told you to see the GP. And also other points would be to not pick your nose, don't blow your nose, try and avoid hot drinks and hot showers for as long as possible, because this can cause it to start bleeding again. And obviously if it does start bleeding again, it's important to obviously compress over the fleshy part and lean forward again. If it doesn't stop bleeding, call us back. And it'll be the same thing as this time, we'll pop you down to the hospital if that occurs. Have you got any questions?
No. Everything, thanks.
And that is the Osce for epistaxis.